Hello, Mr. Richardson. My name is Zach. I'm an Oakland University nursing student. I'm here to do your health history today. Is that okay?
Yep.
Great, wonderful. Let me go wash my hands real quick.
Alrighty.
All right, let me close the curtain, give us some privacy. All right, would you tell me your full name, please?
Tristan Richardson.
Tristan Richardson. Okay. Do you have a middle name?
Yeah, Hugh.
Hugh.
H-U-G-H.
Hugh-G-H. Do you prefer Mr. Richardson or can I call you Tristan?
You can call me Tristan.
Okay, great. And what is your cell phone?
843-847-6000.
Awesome. Can I get your address, please?
Yeah, it is 4752 Goodison Place Drive.
Okay. And your birth date?
Is July 9th, 1990.
All
That
right.
makes me 29.
29 years old. And do you identify yourself as a male?
Yes.
Awesome. And what was your birthplace?
Charleston, South Carolina.
I got a sister in North Carolina.
Oh, nice.
And what is your marital status?
Engaged.
Engaged. Congratulations.
Thank you.
All right. And do you have an occupation right now?
I don't. No.
Okay.
Unemployed at the moment for
Gotcha.
school.
Nursing school taking its priority.
Yeah.
And what race, ethnicity would you say you are?
White.
White.
Caucasian.
White Caucasian. Employer, we're going to put none for now.
Yeah.
Okay. And Tristan, you, the patient, are my source of information right now. You seem alert and oriented, so I would say you appear to be very reliable.
Alrighty.
Aside from me doing my assessment here, is there any other reason you came in for
Nope, nothing in particular.
nothing? Okay, just like a checkup or something?
Yeah.
Okay, great. All right, and how would you classify your health today as of right now?
In pretty good health.
Pretty good health?
Yeah.
That's great to hear.
I think so.
Good health.
No concerns at the moment.
Awesome. All right, let's talk about your past history, maybe something semi-recently, so the last 10 years or so.
Okay.
How would you describe your general health over the last 10 years?
It's been good.
Good.
Yeah. I've had a couple bumps and bruises along the way, but no like chronic issues or anything like that.
Okay, such as life, huh?
Yeah.
Any childhood illnesses that you want to say?
No, not really. Nothing major. Nothing out of the normal.
Did you get chicken pox or anything like that?
I have had chicken pox.
Chicken pox,
Yeah.
okay. Very good. How about any accidents or injuries? Anything?
Yes, I have broken my nose.
Broken nose.
Yes.
Do you remember what age you were?
I think that was actually, I know exactly, it was on my 20th birthday.
20th birthday.
Yes.
It's quite a birthday present.
Yeah.
What were the circumstances? How did this happen?
I fell off, a soccer ball went over a fence,
Ah.
and I had stood up on a high platform from our back porch to look over the fence and try to see it. I lost my footing, fell face first, probably 6 feet from the ground, standing, and then hit my face on a hammock stand with metal poles.
Oh my gosh.
So that caught my fall, luckily.
Okay.
Caught my face.
Luckily. Okay. Any pain from that, or is everything pretty much resolved?
No, I had surgery to fix the brake. And yeah, ever since then, everything's been all good.
Surgery was around your 20th birthday as well?
Yeah, I think we had to wait a week or two for it to set broken, and then they actually have to re-break it. So yeah,
Okay.
2 weeks after that, age 20, something like that.
Gotcha. Okay. And any other injuries?
I broke my wrist, broke that skateboarding.
Skateboarding.
Yeah, that was the left wrist.
Wrist.
Yeah, thumb side here. I had to have a couple pins put in
Okay.
and a cast put on.
It's close to the hand.
Yeah.
Left side. Pins close to the hand. Do you remember? You said it was towards the thumb area.
Yeah, thumb side here.
Okay.
You can still see the little scars.
Oh, yeah.
Pins actually.
Okay. Well, thank you.
Yeah.
Any residual pain or any limitations that you
No,
from that?
that's actually healed up perfectly.
Great.
They did a really good job.
Glad to hear that. Any other accidents or injuries you want to mention?
Just one more.
One more. Okay.
I got hit by a car, and let's see. Yeah, so lots of scrapes and bruises, multiple scars from that. Probably suffered a minor concussion, and then ruptured my spleen. Actually, from being hit by the car. Yeah.
Okay. Were you in a vehicle when this happened?
No, I was on a bicycle.
On a bicycle?
Yeah,
Okay.
I got hit directly from behind.
That was tough.
Mm-hmm.
It's great to hear
Not a
that.
fun day.
No, I'd say not. How about, so you said you possibly got a concussion. Do you have any dizziness or anything like that?
No.
Now, or?
No.
No, nothing. And your spleen, is that fully recovered?
All healed. Yeah, they had to keep me in the hospital for like a night to monitor it because if it got worse, they would have had to do surgery. But luckily, it healed up on its own.
Oh.
So
Thank goodness.
yeah,
Great. Any other accidents or injuries you'd like to mention?
I think that's it for the major ones.
Okay.
Yeah.
Okay. Great. How about any serious illnesses or chronic illnesses?
No, I have mild asthma.
Asthma? Okay.
Yeah, so that's really been the only consistent thing that I've had since a young age.
Does anything in particular bring this on?
Yeah, I've noticed like cold weather will exacerbate it, and then allergens like cats and dogs, and dust, kind of around pollen, all the kind of things that are pretty classic allergens.
Semi-normal.
Yeah, exactly.
Okay. Gotcha. And how do you treat this?
I have prescribed a albuterol inhaler that I'm just kind of supposed to take if I need it.
Okay. Do you need it frequently, or?
No, pretty infrequently. I'll notice like if I'm all of a sudden like there is a certain dog that I'm like, wow, this thing just makes my allergies. Right when I walk in the house, it's like my throat will start to close up. So I'll if I were in that house a bunch over the next couple of days, I'd probably use my inhaler like 10 times. But other than that, I mean, I go months, probably even years sometimes without needing it.
Gotcha. Okay. Very good. Do you have any hospitalizations that you'd like to mention?
No, for those like injuries, I was obviously hospitalized. Like the hit by the car, I think I spent like 2 nights in there. But yeah, nothing outside of related to those specific injuries have I gone in to a hospital now.
Let me go back another question or two. Do you remember what age you were when you broke your wrist and when you got into this car accident?
Yeah, the wrist was about 23-ish, and the car wasn't too long after because they both happened in Salt Lake City. And I was only there for like a year and a half, so probably 24 for the car.
Gotcha.
Yeah.
And you spent 2 nights in the hospital for that.
Yeah.
Okay. Thank you. Any operations over the years that you've had?
So to fix the broken nose, they had to operate like 2 weeks later, as I already said. And then I've also had a sinus surgery that was unrelated to the broken nose. I don't really know technically what they did. I mean, I think they went in there and like trimmed some stuff and like opened up my sinuses. Basically, he was this ear, nose, and throat doctor that my mom said people raved about. So. And I gotta say, my allergies have been a lot better. So,
that's great.
Yeah, it's kind of vague, just sinus surgery, I guess.
But you felt like that gave you some relief?
Yeah, definitely.
Awesome. Good. Surgeries to fix some broken bones as well. Would you say, for the most part, is everything recovered from this?
Yeah,
Still
I gotta
mild
say.
allergies?
Yeah, the allergies are still around, but honestly a lot better here in Michigan since I moved here.
Okay.
So, yeah, I've healed up remarkably well from all the bumps and bruises.
Wonderful. Thank you for that.
Yeah.
We can skip over the pregnancy section.
All right.
But
Yeah,
do you have any kids or anything?
Nope.
No children.
No children.
Okay. Thank you.
Mm-hmm.
Let's see. Allergies. You've mentioned cats, dogs.
Yeah, cats, dogs, dust,
pollen. You
pollen.
said. Okay.
Yeah, the classics.
Was there a certain time frame when this kind of started, or you were diagnosed, or has it been as far as
Not
you
really. Yeah, pretty much as long as I can remember from a young age. I've always had those allergies.
You treat this with the albuterol inhaler.
Mm-hmm.
This provides some relief.
Yeah.
Okay. When you need the inhaler, how much do you usually do?
Usually 1 or 2 puffs, depending on how bad it is.
Okay. Gotcha. And when you do have these allergies, do you get a certain reaction? Itchiness?
Yeah, I'll get like the throat will itch and close up, kind of, which is what the inhaler's for.
Okay.
I'll get like itchy eyes. Sometimes actually itchy skin. If I like a cat comes in contact with my skin, it'll get like raised and red, kind of.
Okay.
That's pretty much it. Sometimes like a runny nose. Again, most of the classic allergy signs.
Sure. Do you get any lesions or hives when you get itchy skin?
Not really. Like I said, if like a cat were to brush up against my skin, sometimes but that's pretty rare, so I wouldn't really categorize it as hives necessarily.
Thank you. Thank you. All right. If you don't mind, I'd like to ask about some family history. Make sure there aren't any risk factors or anything like that.
Mm-hmm.
Do you have any family history of heart disease?
Yes, my paternal grandfather died of a heart attack.
Of a heart attack? Okay.
Yeah.
Do you know how old he was?
He was probably in his 60s. So yeah, late 60s maybe.
Are you aware if he had any heart disease leading up to this, or was it sudden?
I think it was pretty sudden. I don't think he had any symptoms or whatnot leading up to it.
Okay. Any other family with heart disease or anything that you're aware of?
No.
How about high blood pressure? Sometimes they can go hand in hand.
Yeah, my father, I think, takes some meds for high blood pressure. Yeah.
Do you recall the name of the medicine?
I don't, off the top of my head.
Okay. Do you have high blood pressure?
No. Never have.
Thank goodness.
Yeah, so far so good.
I'm proud of my family. How about any family history of stroke?
No.
Nothing like that. Any family history of diabetes?
Nope.
Any blood disorders or anything like that?
Not that I know of.
Okay. How about breast or ovarian cancer?
Nope.
Any other types of cancer?
Yes, both of my mom's parents died at relatively young ages. I think they were both in like their 40s, I want to say. I think there were different kinds of lymphoma cancer.
In 40s?
Yeah, I want to say she was relatively young, so I think they were probably in their 40s.
Gotcha. Any, you know of anything leading up to this, or did they have a history of this?
Not really. I don't know the details too close, but yeah, I think I don't think it was super expected, but so.
Okay. How about any family history of sickle cell?
Not that I know of.
That's great. How about arthritis? Any
No.
swelling, nothing like that in the joints? Okay. How about allergies besides yourself? Does any?
No one else in my family really suffers from that I know of. I'm the only lucky one.
Asthma, you mentioned you had it. Anyone else in the?
Again, not that I know of. I don't know where these things came from.
That one's just all you, huh?
Mhm.
Any family history of obesity?
Nope.
Any alcoholism or drug addiction in the family?
No.
Any mental illness in your
No.
relatives or anything like that?
I know of.
No. Any suicide?
No.
How about seizures or epilepsy, anything like that?
No.
Any history of kidney disease? Kidney stones?
Not that I know of.
Anyone in your family have TB?
No.
Okay. Good. Let's see. And as far as the family members when they're diagnosed, so you said your grandmother and grandfather on your mom's side were kind of in their 40s.
40s, yeah.
Okay. And your grandfather with the heart disease, that was sometime in the 60s that he had the heart attack?
Yeah. I don't know if he was ever like diagnosed, but he passed away of his first heart attack. I don't think he had one before that, but yeah, 60s, I think.
Gotcha. Okay. Well, thank you very much.
Mm-hmm.
If it's okay with you, I'd like to create a quick little genogram, see if we can see if there's any trends in your
Certainly.
any patterns
Mm-hmm.
that we can use to help you make sure that if there's any risk factors that you can be aware of. So,
Gotcha.
all right, let's start with you. How old are you? You are 29.
29.
Do you have any siblings?
I do. I have a younger brother and an older sister.
An older sister. Do you know what their ages are?
Yes, my sister is 30. My brother is 24, I think.
24. Okay. Any marriages for those?
No, both
No.
single.
Strong, independent.
Exactly.
How about your mother and your father?
So my mother has a younger brother and a younger sister.
Is your father older or your mother older?
My father.
Do you know his age?
He is probably like 67.
67. Okay. And your mother is younger?
Yeah, she's like 59, I
59.
think.
Okay. Very good. And I'm sorry, let's go back to what you said before. You said your mother had siblings? Or
Yes, my mother has a younger brother and a younger sister.
younger brother and a younger sister. Do you recall their ages?
Ooh, let's see. Let's go with her brother is about 59 and her sister is like 57.
Okay. And are they married?
So, her brother was married but is now divorced.
Okay.
And of that marriage, she has a daughter.
Daughter. Okay.
Yes.
So that's your cousin?
Yeah.
Okay. Do you know her age?
She is probably like 21.
Do you know the age of your uncle's ex-wife?
I do not.
Okay. That's okay.
Yeah, for the sake of convenience, we could say they were similar in age, but
Similar? Okay.
yeah.
All right. And how about your aunt? On
She
your mom's
is
side?
married with 2 children.
Married, 2 children.
Yep, a boy and a girl. The boy is older. He is, gosh, let's say 26
Okay.
now. He's a physical therapist.
Ah.
Yeah, he just that's a doctorate now. So
My goodness.
he's like younger than me and is a doctor. Goals.
Goals.
And his sister is, gosh, let's say she's like 24.
Okay. Any kids between the two of them?
No, they're both. Yeah, well, he's engaged, but
Oh, okay.
yeah.
Awesome. And do you recall, let's see, that would be your aunt's husband. That would be your step-uncle.
Okay,
Do you know his age?
He is, I think they're the same age. He's 57, yeah.
Okay. Very good. I think we got your mom's siblings. How about your dad's side?
He has 3 brothers.
3 brothers.
Yeah,
Wow, all male household.
I know.
I bet their mom was a saint. And how old are his siblings? Do you recall?
Yeah, he is the oldest, I know.
Okay.
So going down from there, I think the second oldest would be like 65, and the next oldest would be like 62, and then the youngest is like 60.
60. Okay.
Yeah,
Very good. And any of them married?
they all are.
All
Yes. We'll go with the second oldest has 2 children, a boy and a girl. The boy is 26 now, and then the girl is like 32.
All right. And how about the third oldest, the 62-year-old?
He has, let's see, that would be Dana. He is married and has 1 kid, and they got married kind of later in life, so I think that child is like 15.
Wow, okay. Is that a boy or a girl?
Boy.
boy. 15. Good for them.
Yeah.
Having kids at an older age.
Yeah. I did it.
Very good. Very good. And the youngest brother on your
My
dad's side?
youngest brother has 2 kids, a boy and a girl as well. The boy is older. He is probably like 24 now. And the daughter is just a couple years younger. We'll go with 22.
22.
Yeah.
Okay, very good. All right. And let's talk about your grandparents real quick.
Sure.
So on your dad's side, so the 4 boys,
Mm-hmm.
do you recall how old their father and mother were? Your
So,
grandma and grandpa, your dad's side.
yeah, they're both no longer alive. He was the one that suffered a heart attack, so we'll go, he was in his 60s. I definitely don't know the exact age.
Okay.
And she lived a lot longer. She was in her 80s, I think.
80s.
She finally, she passed away like natural causes.
Okay. That's great. Well, it's great. It's how you'd want to go.
Yeah, definitely.
And how about on your mom's side?
So,
This is the one with your grandparents had cancer.
Yep,
Okay.
yeah. So they both have passed away, and they both passed away of cancer in like their 40s. Again, definitely don't know the exact ages, but
Okay. Any other extended family that you can recall off the top of your head?
not really. No, that's pretty much it for the next 2 generations.
Okay. Well, thank you very much. And your father had higher blood pressure. Right?
Yeah.
Okay. Very good. Any other conditions you want to mention for any of these families?
Not really, not that I know of.
Okay. We'll leave it at that for now.
Yeah.
Good, good. And this is all right. Thank you.
Mm-hmm.
Let's move along then. Let's talk about your general overall health, okay? So what is your current weight right now?
Let's say I'm around like 176.
76, okay. Is that pretty average for you?
Somewhat, yeah. I'd say for a long time I hovered in like the 160 area,
Okay.
but then once I kind of started eating more and going to the gym more regularly, so I kind of
Very cool.
beefed up to 176.
That muscle hypertrophy,
Exactly.
huh? Okay, very good. Is your diet pretty healthy, would you say?
Yeah, I think so. I try to be.
Okay.
Lots of, good whole fruits and veggies and whole grains and
That's great.
yeah.
Do you ever experience any fatigue, any weakness, or malaise, any laziness?
Not really. Maybe some if I've gone to the gym or something, but
Sure.
that's pretty
Comes
normal.
natural.
Yeah.
Okay. How about any fever, chills, or sweats, anything like that?
No.
Okay, that's great. Let's move on to the skin, okay?
Mm-hmm.
Any history of skin disease, eczema, psoriasis, anything like that?
Nope.
Nothing like that, great. Any pigment or color change recently that you've noticed?
Nope.
Okay.
Got a little darker over the summer, but I think that's normal.
Summer. That's good, okay. Do you have any moles or anything like that?
No, none of any concern. Kind
Okay.
of smaller,
Small ones.
normal ones, whatever you can say. but-
Everything's looking symmetrical,
Yeah.
same color, no heights.
Yeah.
Okay. Borders clear.
Yeah.
Wonderful.
None are over 6 millimeters, that's for sure.
Okay, great. Oh, you were well informed.
I try.
Very good.
More you know.
Okay. How about excessive dryness or moisture or anything like that?
No, not really. I've got sometimes I get some dandruff.
Dandruff,
I actually have had it like lately. So I need to do something about that. But
Okay.
I also just have started washing my hair with just like soap.
Okay.
Well, like Dr. Bronner's
Okay.
soap. So
That seemed to help.
not really. It actually might be causing it.
Oh no. Why did you try to start using this?
I don't know. I just it's all like I try to use as many like natural products as I can. So I think somebody like told me like, yeah, I just wash my hair with that. So I was like, that's a good idea.
That's
It's
interesting.
like cheap and yeah. So I hope that's not causing the problem. But I've heard you can add a little like tea tree oil helps, or like random things like that. So I might start trying some things to combat it. But,
My brother lotions his hair sometimes.
really, I've heard of that too, because there's all these things they say for dandruff, and it's like, yeah, rub this lotion here. I'm like, well, I can't do that and leave the house. So maybe right before I shower, I'll have to put some stuff in there. But
Very good. Okay, so try natural remedies, and soaps or lotions for the dandruff. Okay.
yeah,
How about any itchiness or scratchiness of the skin? Just
not
aside
really.
from your allergies, something.
Yeah, no, nothing abnormal.
Any excessive bruising anywhere?
Nope.
No, bruises seem to heal up
Yeah.
appropriately.
Mhm.
From blue to purpley yellow.
Yeah.
Okay. Any rash or lesions that you're aware of today?
Nope.
Let's talk about your hair. Any recent hair loss? Or-
Not really. I think I might be thinning a little on top, but my mom's dad was pretty bald, so
okay.
I heard through the grapevine that might be causing me to have some fun with it. But
Any change in texture? Or is it pretty
no,
consistent?
yeah, pretty consistent.
Okay. How about your nails? Have you noticed any change in shape or color,
No, not really.
Any
Pretty normal, healthy.
rigidity, or anything like that?
No,
That's
that's
helped.
good to
Healthy nails. That's great.
Mm-hmm.
How about the amount of sun you get? You said you get a little darker during the summer.
Yeah, definitely. My last job I worked outside a fair amount. So yeah, and I love the water, so I try to spend a lot of time outside in the summer, but try to use sunscreen most of the time. I would say I do.
That's
So,
excellent.
yeah.
I'm sure you're aware we in Michigan are at a high risk for vitamin D deficiency.
Yeah. On the
So
other side of the spectrum.
that's great.
definitely
You're getting the sun
in
exposure.
the winter. Yeah.
I'm glad you're using sunscreen.
Mm-hmm.
So it's, UV light, or they can affect our epigenetics or how we express certain genes. So
Yeah.
I'm sure you're aware of it. You can get like skin cancers. Things
Yeah.
like
Yeah. Definitely want to avoid that.
that. Do you know what SPF you usually
I'll typically
use?
use like 30 on my body and then like 50 on my face.
Okay. Very good. It's a little thinner.
Yeah.
Okay. Very good.
Yeah.
Okay. Let's talk about your head.
All right. Thought you'd never ask.
So you said you had a possibly concussion when you were younger.
Yeah.
With that car accident. Do you have any frequent or severe headaches
No.
now, or
I'm not lucky. I almost never get headaches.
that's awesome.
Yeah.
Besides that potential concussion, any other head injuries?
No. Nothing major that I can think of.
Any dizziness or vertigo? Do you ever feel like the room's spinning?
No, not really.
Well, that's great. Okay, let's talk about your eyes, okay?
All right.
Any difficulty with vision?
No, not really. I've got pretty good vision.
That's great. Any decreased acuity? Are you able to focus on far objects and close objects?
Yeah, for the most part.
You adjust to light pretty good?
Yeah.
Okay. Any eye pain or anything like that?
No.
How about double vision?
No.
Nothing like that. Do you use glasses or anything like that? Contacts?
Nope.
Any redness or swelling?
No.
Sometimes from allergies or from
Yeah, sometimes with allergies, but usually they get more watery and
normal circumstances, you would say.
yeah, definitely.
Okay. Any glaucoma or cataracts or anything like that?
No.
Right. Watery discharge sometimes with the allergies. Okay.
Yeah.
When you're out in the sun, do you use sunglasses?
I don't really like wearing sunglasses. I'm told that I should.
Okay.
So sometimes would be the answer for that. Yeah.
Sometimes. Okay. Gotcha. Okay. Any vision loss, anything like that?
Not that I know of.
That's great. All right. Let's move away from eyes and talk about ears for a minute. Okay.
Okay.
Any ear aches or infections that you're experiencing?
No, not really.
Okay. Any discharge or any excessive earwax, anything like that?
No.
How about any ringing of the ears?
Nope.
No? Great. You mentioned no vertigo, no spinning or dizziness,
No.
anything like that. Okay. No hearing loss or hearing aid use in the family.
No.
Awesome. Are you exposed to loud environments ever?
Not
Loud
really.
music
I
or
listen to
heavy
music sometimes, but I try to keep it at a reasonable volume.
Okay, great. Awesome. That's what I have for eyes. Let's move on to nose and sinus, okay?
Okay.
Any discharge or other characteristics? Any sinus pain?
No, not really.
You know,
Pretty
you,
good.
you had that surgery
Yeah,
and some
surgery.
allergies.
Yeah, surgery helped a lot.
Okay. How about any colds or anything like that? Any congestion?
Occasionally, if I get a cold, I'll be a little stuffed up or runny, but nothing out of the ordinary.
Gotcha. Any nasal obstruction or anything like that? Anything blocking your
No, not really.
Any frequent nosebleeds?
No, I almost never get nosebleed.
That's great.
I have like one.
All right, we've already talked about your allergies to cats, dogs, dust, pollen, that sort of thing.
Yeah.
You use the inhaler to treat that.
Mm-hmm.
That's all we need for that section, all right?
Okay.
Let's talk about your mouth and throat, all right?
Mm-hmm.
Any mouth pain or sores that you're feeling?
No.
Nothing like that.
No.
Any bleeding gums?
No.
Toothache or lesions on the mouth or
No.
tongue? Nothing like that.
No.
Any trouble swallowing when you're eating?
No.
That's great. Any hoarseness of your voice or rasping, anything like that?
No.
What would you say your daily dental hygiene is consists of?
I'm pretty good about my teeth. I don't know when it started, but I've got a whole routine. Yeah, brush and floss at night, and use like a fluoride mouth rinse.
Wow.
And then brush in the morning.
Awesome.
Yeah.
Great job. A lot of health problems can be attributed to,
Yeah.
oral care. So
Yeah.
I'm glad you're taking care of yourself there.
Yeah.
How about any neck pain, or do you have any limited motion? Range of motion?
No, not really. Pretty good. Yeah.
Good. Okay. Any lumps or swelling? Any tender nodes or
No,
lymph nodes?
unfortunately not. No.
Okay. No goiters or anything?
No.
Okay. Great. How about any breast pain or anything like that?
No.
Any lumps or anything like that? Do you
No.
check regularly?
I wouldn't say regularly, but I haven't found any of it.
Gotcha. Oh, that's great. Any nipple discharge or anything like that?
No, unfortunately not.
Unfortunately, not. Well, one can only dream. Any rash or history of breast disease in the family?
No.
Any surgery on breast?
No.
How about your armpits? Any tenderness or any swelling around lymph nodes here?
No, not really.
Everything seems pretty good.
Yeah.
All right. Any rash or anything like that from deodorant or other irritants?
No, not really.
Okay. Let's see here. Okay. How about, let's talk about your respiratory system, okay? Do you have any history of lung disease in your family?
No.
Just your asthma?
Asthma. Yeah, pretty mild.
Okay. Any bronchitis or issues with the lungs, pneumonia, things like that?
No.
Have you been screened for tuberculosis recently?
Yes.
You have? Everything's good there?
Yeah.
Right. Any chest pain when you're breathing? Or any wheezing, anything like that?
No, not really. If I with those allergies, wheezing will lead to me needing my inhaler for allergies, but
Okay.
not regularly.
Gotcha. How about shortness of breath? Anything
No, not really.
aside from exercise?
Yeah, aside from that.
Okay. Speaking of exercise, how much activity would you say would it take to get you a little out of breath? Moderate to
Yeah, pretty like fair amount. I mean, I
Sure.
don't get like winded going up a single set of stairs.
Sure.
But multiple sets, I might be able
I gotcha. I gotcha.
breathing a
You
little
look pretty fit. So that's
Yeah, thanks.
good. Okay. Any cough or anything coming up from your cough?
No,
Or phlegm or no blood or anything like that?
no,
Okay. Any exposure to toxins or pollution from the air? Anything like
not really.
that? Okay. Not really.
Yeah, not really. I mean, besides the normal amount.
Okay, yeah. Just everyone's exposed to some air pollution.
Yeah.
Okay. Already addressed that you use your inhaler as needed for asthma. Have you gotten a chest X-ray ever?
I imagine somewhere along the line I have. I don't know what they did after they found out I ruptured my spleen. They had to do something, so I imagine I got it x-rayed back then, but it's been some time.
That was around age 20 or something?
Yeah.
Okay.
Or yeah, 20, I was like 23.
23.
Was the car.
Okay, so possibly around age 23. Chest
Yeah.
X-ray. As far as you're aware, everything looked good?
Yeah, they didn't mention it, so.
Good, good. All right, let's talk about your cardiovascular system, okay?
Okay.
So do you have any pain, either behind the sternum?
No, not really.
Any problem when you're lying down? Just you getting shortness of breath or cough?
No.
No?
No.
That's good. How about, let's see here, any swelling or anything like that?
No.
No extra fluid?
No.
Okay. Any history of heart murmurs in your family?
No.
Nothing? Just your dad with the
Hypertension.
Hypertension.
Yeah.
Coronary artery disease, your grandfather?
Yeah. Yeah. The heart attack.
Gotcha. No anemia in your family, or no low blood cell count?
No, not that I know of.
Okay. Do you recall ever getting an EKG, heart examination?
Not that I can recall.
All right, that's good for cardiovascular system. I'd like to move on to circulation in extremities, okay?
Okay.
Do you get any coldness or numbness or tingling either in your
No.
hands, your feet?
No, not really, besides like in cold weather or something
Sure.
like that. But
Nothing abnormal?
yeah, nothing out of the ordinary.
Okay. No discoloration or anything like that?
No.
Retinals, get good capillary refill. Any, if you squeeze this, does your get some good blood flow back in your?
Yeah.
Okay.
It's pretty good.
Great. No blue color, nothing, no pale skin,
No.
no mottling or spots anywhere,
No.
aside from just the small little freckles.
Yeah.
Okay. Do you get varicose veins or
Not yet.
big vein? Nothing yet. Do you have a family history of varicose veins?
No, not really.
Okay.
Yeah.
Okay. Great. And do you have any pain in the extremities due to poor circulation, anything like that?
No.
If you're sitting for a long time or standing for a long time, anything bug you?
No, not really.
Okay. Any ulcers or anything like that?
No.
Nothing? Okay. All right. Let's move on to the GI system.
Okay.
Do you have a good appetite, would you say?
Oh yeah.
Excellent. Me too.
Insatiable.
Insatiable. Any food allergies or intolerances?
No.
Okay. Okay. Any problems swallowing certain foods?
No.
Anything like that? Do you get heartburn or indigestion ever?
Occasional, just within like the last year or even more recently, I've developed occasional heartburn. So I'll take like whatever Tums for that if I need it, but
Okay.
that's not super frequently.
Okay. So nothing excessive with antacids or Tums or anything like that?
No.
Well, that's great because we've learned recently that it can lead to certain electrolyte imbalances, which like
Okay.
phosphorus or magnesium. So
Okay, yeah,
Wow.
I just try to take one, maybe two if it's bad.
Okay.
Yeah.
that's great. Sounds very reasonable. Do you get any other abdominal pain or burning sensation
No.
ever? No sour burps or anything like that?
No.
Okay. Any nausea or vomiting?
No.
Nothing like that. How about history of abdominal disease? So things like ulcers or gallbladder problems?
Nope.
Nothing like
Nothing I
that.
know of.
Great. No history of jaundice or yellow skin?
No.
Appendicitis?
Nope.
Nope. Still got your appendix?
Yeah.
Okay. History of colitis?
Mm-mm.
So that's like irritation in the bowels?
Nope.
Nothing like that. Any abnormal flatulence?
No.
Passing gas is good?
Healthy amount. Yeah.
Great. Frequency of bowel movements. Do you have a regular bowel movement?
Yeah.
Okay. You say once per day?
Yeah. Roughly.
Okay. Any characteristic changes in that stool? Any different color or consistency?
No. Nothing to get too excited about.
Okay. Any constipation or diarrhea?
Nope.
Everything flowing smoothly?
Yeah.
Okay. No black stools or bleeding, rectal bleeding?
Nope.
Okay. Any hemorrhoids or any fistulas, an infected tunnel or anything like that?
No, not really.
Okay. You mentioned you use antacids, but reasonably.
Yeah.
Great. Any use of laxatives or anything like that?
Nope.
No reason to. Everything's moving smoothly.
Yeah.
Great.
Definitely.
How about your urinary system? How often do you see you go to the urinal?
Probably like 3 or 4 times a day. Something like that. Depends how much water I'm drinking.
Sure. You feel like you stay hydrated usually?
Yeah. I usually carry a water bottle with me and try to do a good job of drinking it.
Is the color pretty consistently, light yellow?
Yeah.
No dehydration?
No.
Okay. Any excessive urine or small amounts of urine?
Nope.
No pain when you're urinating?
Nope.
Okay. Any hesitancy or straining, or everything's freely?
Nope. Good to go.
Good to go. Awesome. Color's good. No cloudiness or anything like that.
Nope.
Okay. Any incontinence? Any trouble getting to the restroom in time?
No.
Okay. How about any history of urinary disease? Any kidney stones or kidney problems?
Nope. Not that I know of.
Great. Any UTIs? Any urinary tract infections?
No.
Okay. It's more common for girls, I know. Guys can certainly get them.
Yeah.
Any prostate problems in your family?
No.
Okay. And any pain around that area?
No. Not really.
Kidney region, nothing like that?
No.
Great. Okay. All right, and you practice good hygiene, right?
Yeah. Yep. Shower regularly and keep clean.
Awesome.
Yeah.
Not at risk for UTIs or anything like
No.
that? That's great. Any penis or testicular pain?
Nope.
No sores or lesions?
Nope.
Lesions?
No.
That's great. Any abnormal discharge?
Mm-mm.
Nothing like that.
Nope.
Any lumps that you've ever felt?
No.
No. Have you ever had a hernia? Any
I have
organs
not.
poking through? when they
No.
shouldn't be?
My younger brother had one.
Is that right?
Yeah. But no, I've never had it.
Did he just overexert himself one day?
Good question. I don't know. He was pretty young when he had it, so I don't know if it just happened somewhat naturally along the line, but I'm not sure.
Some bacteria or something.
You know?
Okay. Do you perform regular testicular examinations for lumps, things
Probably
like
not as often as I should,
that? Okay.
but haven't noticed anything out of the ordinary.
Okay. We will skip over the female genitalia system, unless there's
Yep.
something you want to tell me.
Nope.
All right.
Absent.
Absent.
Unaccounted for.
Very good. Let's talk about your sexual health, okay?
Okay.
Are you presently in a relationship involving intercourse?
Yes.
Nice.
Mm-hmm.
My man. Are aspects of sex satisfactory to you and your partner?
Yes. I can answer for myself. Yeah.
No complaints from her? Great. Any changes in erection or ejaculation?
No. Pretty regular.
Okay. Use of contraception. Do you guys use that?
We use condoms.
Condoms. Okay. Is that okay with both of you? No one's
Mm-hmm.
complaining about anything?
No.
Okay. Do you use condoms every time or on occasion?
Yeah,
Every
every
time.
time.
And any contact with a partner who's had any sexually transmitted diseases, anything like that?
Nope.
Nice. Very good. All right, we're getting close to the end, I promise. I'd like to talk about the musculoskeletal system.
Of course.
So, any history of arthritis or joint pain? Anything
Nope.
like that? No stiffness, no swelling?
Nope.
No deformities or limited motion anywhere?
Nope.
Okay. Any noise with certain joints? Any popping or clicking anywhere?
Occasionally. This elbow here will kind of click sometimes, my left elbow, but I've had an orthopedic surgeon look at it, and he'll be my father-in-law soon.
Oh, okay.
And he said it all looks normal. So.
Okay, good. How about muscles? Any pain or weakness, cramps in muscles?
Nope.
That's great. Any problems walking?
Nope.
I think that's
Love
good.
to walk.
Awesome. Glad to hear that. Any back pain or anything like that?
Nope.
Just wait till we get into nursing school. Right?
Yeah.
Clinicals.
Yeah, seriously.
Just practice good back health.
Yeah,
Maybe
try to.
lift with
Trying
the
to get
legs,
it nice
right?
and strong now.
Yeah. Lift with the legs. All right. Any stiffness of the back or any limitation of movement, anything like that?
Nope.
All right. You mentioned you like to walk.
Mm-hmm.
You say you walk pretty regularly?
Yeah,
Most days.
fairly. Like my previous job was on my feet a lot, so walking back and forth, and so yeah.
That's great. Cool. Do you have any problems with muscles or skeletal in terms of taking care of day-to-day activities?
No.
Washing, bathing, feeding?
No.
Everything
We
good?
do pretty much everything now.
Okay. So we'll quick talk about your neurological system, okay?
Okay.
Do you have any history of seizures or fainting, blackouts, anything like that?
Nope.
You already mentioned no stroke history in the family.
No.
That's great. Any weakness or tics or tremors?
Nope.
Nothing. Good. Any paralysis in any limbs or?
Nope.
Everything seems to be communicating appropriately.
Yeah. So.
Coordination is good.
Yeah.
All right.
I'm playing a lot of badminton lately.
Is that right?
Yeah.
That's good.
Super fun.
Hand-eye coordination.
Yeah.
Awesome. In terms of cognitive function, do you have any trouble with memory,
No.
short-term
Got
memory
pretty good-
loss?
Pretty good memory.
Good. Come in handy for clients.
Yeah.
Any nervousness or change in moods?
Nope. Not really.
That's good. Any family history of depression, anything like that?
Nope.
Any other mental health problems or hallucinations? Like that?
Nope.
That's good.
Mm-hmm.
That's good. Let's talk about your hematologic system, so your bleeding, things like that.
Okay.
Do you have any, what would you say the bleeding tendency is of skin or mucus? Anything abnormal?
No. Can't remember the last time I bled a lot, which is good.
So that's great. You said you floss regularly.
Yeah.
Gums are good.
Yep.
Mucus linings.
Yeah.
sneaky.
Occasionally it'll bleed like once a month or something, but it's pretty normal.
You already said your lymph nodes are pretty good.
Yeah.
No blockage or drainage problems.
That's what I've noticed.
Okay. And any exposure to toxins or radiation, any abnormal?
Not.
Hopefully not, yeah. Any blood transfusions that you've received?
No.
Okay. Let's talk about your endocrine system real quick, okay?
Okay.
Any history of diabetes in your family?
No.
Right?
No.
You've already mentioned urine is pretty steady.
Yeah.
Not too much, not too
Healthy.
little.
Yeah.
No different colors, anything like that.
Nope.
Any history of thyroid disease in your family?
Nope.
All right. Any intolerance to heat or cold?
Not really.
Okay.
It's my fiance that has that.
Girls get cold, right? Any change in skin pigmentation or texture?
Nope.
No, everything's normal.
Yeah.
Any excessive sweating, daytime or nighttime?
Nope, not out of the ordinary.
Okay. Would you say your appetite and weight are pretty consistent?
Yeah.
No yo-yo,
No.
ups and downs, something like that. And any need for hormone therapy, either yourself or your family?
Nope.
Okay, great. Let's just finish this up with a functional health assessment. Okay. So, what's your latest education? What's the latest grade you've accomplished?
I have a college degree, a bachelor's of science in anthropology. Yeah.
Okay. Very good. Any other trainings or certifications?
No.
No. You're currently a student right now?
Yes. Yeah. Currently in nursing school.
Nursing school. Okay. Are finances comfortable at home?
Yeah. Yep. I'm able to, fortunately, not have to work while I'm in school.
That's awesome.
Yeah, definitely.
Very good. Do you have a value belief system? Do you practice religion or anything like that?
No real organized religion that I take part in, but I'm not opposed to like spiritual thinking. if you will.
That's great. And other self-care behaviors, anything you like to do to...
Yeah, I travel. I've been lucky enough this summer. I traveled a bunch. Try to do stuff that I enjoy: cooking, reading, if I can find the time these days.
Sure.
But,
I'm sure there's no shortage of reading.
yeah, reading for pleasure. I should
There we go.
specify.
Do you travel outside of the country?
Yeah, I have. Let's see, went to Peru this summer.
Did you? I went to Peru this summer.
Oh, really? Machu Picchu?
I did, yeah.
A little known little site there.
Very
Yeah, went and did Machu Picchu. Previously to that, my fiance and I hiked around the very southern tip of South America, so Chile and Argentina.
Awesome.
And then before that, we hiked for 2 months in New Zealand.
Wow.
So, yeah, big traveler.
Really awesome.
Yeah, I've been fortunate enough to do a lot of traveling.
That's great.
Yeah.
When you go to these locations, do you get all the necessary vaccines?
Yeah.
Immunizations?
Yeah.
Yellow fever, that sort of thing? Okay.
Yeah.
You mentioned you exercise, right?
Yeah.
Is that a pretty regular activity?
Yeah, I try to get in the gym like 4 days a week, I'd say.
Great.
Yeah.
Cool. What do you do when you go to the gym?
Mostly like weightlifting. I need to be better about doing some more cardio type stuff, just steady state.
Don't we all?
So yeah, mostly weightlifting. Some, I don't know, like ab work and stuff like that. I don't know what you would say about it.
Sure. Okay. In terms of activities of daily living, do you need any help with anything? Are you pretty independent?
Pretty independent. Can do it all on my own.
Awesome.
Yeah.
Leisure activities, you mentioned you like reading for fun.
Yeah, reading for pleasure. I love cooking. I'm always cooking. Yeah, I've been playing a lot of badminton recently, like I said. Yeah, stuff like that. Travel if I can. It'll be a little while.
Great. Let's talk about your nutrition real quick. All right.
Okay.
What would you say an average day of eating looks like?
Like a pretty healthy breakfast, eggs, some kind of grain. I'll do grits sometimes, or like toast, fruit, and then oftentimes I'll either take leftovers from dinner or for lunch, like a sandwich. And then dinner is usually like something with some kind of lean meat, hopefully like chicken or fish, and then lots of vegetables, some salad, and things like that, and some kind of whole grain.
Sounds like you're very well educated in nutrition.
Yeah, try to be. Yeah,
doing better than most. And we've already talked about elimination and everything. Exiting smoothly.
it is.
In the bathroom area.
Yeah,
Cool.
definitely.
Okay. And this is a pretty standard eating pattern for most days.
Fairly, yeah. Obviously, here and there with time constraints, I'll eat out occasionally, but even then, I try to do the healthier option.
Who buys the food at home? Do you buy it?
My fiance and I, we kind of split up trips to the grocery store and paying for it.
Do you take turns preparing the food, or
I'd say it's a little uneven. I think because I like to cook, I get that
okay.
responsibility a lot of times. She doesn't think she's a good cook, so that's her excuse to not have to cook. But she's getting better. She'll surprise me with a meal every now and again.
That's nice.
Yeah.
We've already mentioned finances are pretty stable.
Yeah.
You have enough food is adequate at home.
Yeah. Oh yeah. Wonderful.
Who's present at meal times?
Sometimes just me, sometimes her. It depends on the day. She's also a nurse, so she works nights. So sometimes I'll miss her for dinner here, breakfast there, random things. So sometimes it's just me, sometimes it's the both of us.
Okay, sounds good. A little mixture.
Yeah.
How would you describe your role in the family?
Well, with her and I, I get along well. It's an interesting dynamic now because we live with her parents, but it's actually been going flawlessly. We get along great with them, so
That's great.
yeah, get along well with everybody. Try to pull my weight and help out where I can, and be a comedic relief sometimes.
That's important.
Yes, definitely.
Would you say you get along well with friends, your wife, or
Yeah.
your fiance rather?
Yeah.
And, her family, everything's good?
Yeah.
Where do you get your support system from? From her? From
Lots of people, yeah. From her family, my family. Don't see them as often. They're down in South Carolina. But, yeah. I try not to be I can get through it on my own type.
Sure.
It can help to reach out to people. So
Sometimes you gotta talk to someone.
definitely.
All right. On an average day, how much time would you say you spend alone?
Typically like several hours, especially now that I'm starting school, studying and stuff like that. It's spent mostly alone, and so yeah, several hours typically.
Do you find this time enjoyable, or do you ever get bummed out that you're on your
No, I'm pretty self-sufficient on my own, so yeah, definitely don't mind being solo.
own? Awesome. How about stress right now? Everything pretty good? or
Yeah,
any
minor
stress?
things with school, but nothing out of the ordinary.
How do you manage that stress?
That's a good question. Talk to people. The gym is a huge part of it. That's one of the reasons I started working out so frequently. I didn't realize it could do so much for mental health.
Yeah.
But so yeah, the gym I'd say is my main one. But cooking, I love cooking. It's funny, other people look at it as like a chore, but like cooking and listening to music is like my happy place.
That's awesome.
That's definitely a big stress reliever.
Very good.
Yeah.
And these methods of coping, they're helpful, you would say?
Yeah, I think so.
Good.
Yeah.
Awesome. Any changes in the past year that would add to stress or take away from stress?
No, not really. Like starting school and not working anymore is kind of a life change, but
Sure.
it seems to be going pretty well so far.
It's a good life change. Absolutely. Positive life change, hopefully.
Yeah.
Any personal habits? Do you drink coffee?
I do. Yeah. I drink a fair amount of coffee. I try to leave a day or here or there that I don't drink it, just so I'm not super dependent upon it. But I'd say about 4 days a week, I
Gotcha.
drink some coffee.
You like caffeinated beverages too?
I don't drink a whole lot of soda. So if I am drinking something caffeinated, it's a random sugar-free energy drink but that's like a treat. So I'll have that once a month maybe or something like that.
Gotcha. All right. Do you smoke?
No.
Okay. Very good. Congratulations.
Thank you. Yeah.
Do you consume alcohol?
Yeah. Like a craft beer.
Craft beer. Very good. When was the last time you drank alcohol?
Oh, probably a couple days ago. I don't know, 3-4 days ago, something like that. Since I've started school, it gets delegated more to the weekends now.
Sure. Gotta stay focused.
Yeah, if I came on a weeknight, I'll have a beer or something.
Okay. The last time you drank, what would you say was an average drinking?
Since it was probably last weekend, I probably had 2 beers or something like that.
Okay. Over the last month or so, how many days would you say on average you drink alcohol?
Oh, it fluctuates, but in a month, maybe like 5 days. Yeah, usually on the weekend, I'll have a couple beers in a day, something like that. Gotcha.
Has anyone ever told you had a drinking problem?
Nope.
And do you use any other street drugs, marijuana, cocaine,
Nope.
amphetamines, something like that?
No.
No. Okay. In terms of your environment, would you say you live in a safe neighborhood?
Yeah. Yep. Very nice, affluent neighborhood.
Awesome. And you said you live with your fiance's family, right?
Yep. Mm-hmm.
Okay. Do you know the neighbors?
I think I've met them. Don't know them too well,
Just
but
acquaintances?
yeah,
Okay.
definitely. Yeah, her parents know them better than I do, but gotcha.
Everyone's civil.
Yeah, definitely.
You get enough heat and air conditioning where you live?
Yep.
You have a means of transportation?
Yep.
Yeah.
I own a car.
Awesome. Are you involved in any community services, volunteer work?
Unfortunately not. I'd like to get better about that and get involved in a thing or two, but
Time is of the
yeah,
essence,
it's always
huh?
when I have the time. So.
Sure. Any other hazards you can think of at the workplace or home?
No, not really.
When you're driving, do you use the seatbelt?
Oh yeah.
Awesome. Traveling to other countries, you said you went to Peru, New
Yeah.
Zealand,
Yeah. Yeah.
Argentina. That's awesome.
Yeah.
Cool. Yeah, very good. Have you ever served in the military?
Nope.
Okay. And in terms of partnership, do you feel safe with your partner?
Yeah.
No fights or any trouble, anything like that? Have you ever been emotionally or physically abused
No.
by a partner or anyone else?
No.
Has your partner ever forced you into having sex?
Nope.
All parties are willing.
Mm-hmm.
Are you ever afraid of your partner?
No.
That's good. Do you have a job right now?
Nope. As I said, I worked up until fairly recently, but once I started school just a couple weeks ago, I ceased that job.
Gotcha.
Yeah.
What did you do before?
I was a handyman, construction worker, maintenance man, kind of conglomeration of things.
Okay. And let's see here. How would you define health?
Good question. Just being able to live the life you want to live, have nothing impeding your lifestyle or
Sure, everything's functional.
yeah,
There you go.
exactly.
Okay, great. Do you have any other concerns that you want to mention today?
No, nothing I can think of.
Just a regular checkup, right?
Yeah.
Okay. What do you hope or expect to happen for your health going forward?
Just to hopefully maintain a healthy lifestyle and, like I said, be able to live the life that I want to live, be as active as I'd like to be, and
You'd say that's pretty consistent with your health goals too, just remain
Yeah.
independent.
yeah, definitely.
And now I'm just curious, what are your expectations of nurses or physicians? What do you think they should do or shouldn't do?
Just to do the best they can to take care of their patients. And,
Okay. Well, thank you so much, Tristan. I appreciate your time here.
my pleasure.
I'm gonna go wash my hands, and do you have any questions for me? Any other concerns?
No, that pretty much does it.
All right. Well, thank you so much.
Yeah, take care.
All right. Wash hands.